Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Deborah Smith. She's a nurse, and we're going to talk about the KevinMD article, Battling Aplastic Anemia, My Journey with Antithymocyte Globulin Equine Therapy. Deborah, welcome to the show.
Thank you so much for having me.
So let's start by briefly sharing your story and journey.
I've been a nurse for 50 years. I had to retire a little sooner due to my healthcare scare. I was diagnosed in 2017 with T-cell lymphocytic leukemia, which was a bit of a shock. So I went ahead and retired ahead of time. And of course, then I went through 18 months of chemotherapy. And things were going well, but then things started going downhill after that. So then a couple of bone marrow biopsies later, I showed aplastic anemia conversion. So we had to redirect the chemotherapy route and put me on cyclosporin and some other things. Well, then my doctor decided to try the equine immunotherapy ATGAM. Okay, that's an extremely expensive, highly dangerous drug, and I had to be hospitalized for that. But I'm blessed, everything went well. I had no side effects from it, and things have gone progressively well. I've ended up having 3 rounds of this, 1 per year. My last one was this past March in 24. I did have a couple little snags along the way, but things are starting to turn around again. But the side effects I experienced during the therapy, I would like for people to be aware of, because not everybody has the same journey as I've had. My number one problem was I felt so cold. Your immune system gets wiped out with this therapy, and you just feel like you've got ice water running in your veins. You can't get warm no matter what you do. You experience extreme fatigue because everything goes wiped out, but it usually recurs very quickly. My side effects only lasted 4 or 5 days, and by the time therapy was finished, I was fine. So,
all right. So you talk more about this in your KevinMD article, Battling Aplastic Anemia, My Journey with ATGAM, or Antithymocyte Globulin Equine Therapy. So before we talk about the therapy itself, tell us how you were feeling when you first got that diagnosis of leukemia that subsequently progressed into aplastic anemia. What led you to go to the doctor in the first place to start that diagnostic journey?
I had extreme fatigue. I couldn't walk more than 20 feet without having to stop and rest, and extreme shortness of breath. So my doctor did a complete cardiac and pulmonary workup, which were within normal limits, but the symptoms persisted. And hemoglobin was done, CBC. White count was normal, but my hemoglobin was only 4. I was still working at the time with a hemoglobin of 4. I was about to drop my teeth with that. So then I received emergently 4 blood transfusions. And that's when the journey began, was in the spring of 2017. I cut down to part-time work. At the time, I was a nurse educator for all the med-surg units in my healthcare facility. And I was also the go-to person for preparation for Joint Commission, which takes a lot of time and effort to get all that done. So then in August of 2017, they did the bone marrow biopsy, which revealed the T-cell lymphocytic leukemia. And I thought, I'm going to be busy doing healthcare, going to the doctor, getting transfusions. So I went ahead and retired. And they started chemotherapy in September. It was oral. I took it every day. And it seemed to work. So then I was on it for 18 months. The doctor took me off of it. And things were going well for about 6 months. And then I noticed my hemoglobin started to drop a little bit. Mm-hmm. So then the doctor put me on a different routine, put me on Cytoxin. So I was on that, and the results were astounding. My hemoglobin shot to 15. I had energy. The shortness of breath was gone. I just felt fabulous. Well, that worked for about a year. And then I started going downhill again. Well, in the meantime, my sister, with whom I live, we moved from Indianapolis to Bloomington. And for a while, I was going back and forth to my oncologist in Indianapolis. Well, that was a bit of a hassle, especially during nasty weather. Mm-hmm. So I found an oncologist here, Dr. V.J. DeMarla, with the Illinois Cancer Care Center, and he has been a lifesaver. I mean, he consulted the doctor in Indianapolis to let him know what was going on. But it's been an incredible journey, and I feel extremely blessed with that.
Now, to get everyone up to speed, tell us a little bit about what aplastic anemia is. Give us a 30-second primer just to get everyone on the same page.
Okay, aplastic anemia means your bone marrow is deficient. It does not produce the stem cells, they're damaged. And so you don't have red blood cells to carry hemoglobin around to your system, which causes the extreme fatigue and extreme shortness of breath. And the only way, there is no cure for it unless you want to have a bone marrow transplant, which is a really complicated procedure. And my Dr. DeMarla and I consulted a physician up in Chicago, an expert, and he recommended that being my age, I'm 72, it really wasn't that advisable to go through with that procedure because the side effects are much worse, mm-hmm. and it wouldn't be as effective. It's only a 30% chance of success rate with my age group. So I'm doing the oral medications again, which doesn't bother me. But so far, everything is copacetic.
So tell me the decision-making process that led you to ATGAM equine therapy. And again, ATGAM is an acronym for anti-thymocyte globulin. Tell us the path and the decision that led to that.
Well, I'm very lucky to have Dr. DeMarla as my physician. He tells me he only has 2 patients in his entire practice that tell him what to do, and I'm one of them. So we discussed the different options. I had regular immunoglobulin therapy first for a week, 4 days, 8 hours for 4 days. And then shortly thereafter, we decided to go ahead with equine. Equine is a little bit superior to regular immunotherapy. The immunoglobulins are withdrawn from humans and injected into the thymus gland of a horse. They incubate for a short time, then that's pulled away from the horse and then given as an infusion. And the infusion is 8 hours a day for 4 days. Mm-hmm. Although it can be given for other organ transplants to upwards of 2 weeks at a time. But for my situation, we decided that the 4 days would be sufficient for that. And you do have to be hospitalized. It cannot be given as an outpatient because it is such a high-risk drug that the side effects could hit you like a ton of bricks, and you wouldn't be able to take care of it as an outpatient. So I made the trek to the hospital. But I enjoyed myself there. I had a good time.
Who are the candidates that would be under consideration for ATGAM equine therapy?
Is generally given to adults between 30 and 80. Children usually don't respond quite as well. They usually respond to other forms of treatment. And the equine therapy that is given at a later date, if things are not succeeding. Mm-hmm.
And how often would you have to go through that infusion, or is it a one-time thing?
I've gone through it 3 times, mm-hmm. once a year. They don't recommend it as very often, but in my case, since I wasn't responding, and the doctor did another bone marrow biopsy to see if I had converted to a myelodysplastic syndrome or if there was something else going on. And fortunately, I didn't have anything going on. So they went ahead and did the equine therapy for the 3rd time. I did have a few side effects, but they were few and far between on that.
And is this something that you feel or your doctor feels that you may need to undergo yearly?
Possibly. I told him I would be willing to do it again.
You mentioned as part of your story some of the side effects when you were undergoing equine therapy. So during those 4 days when you were being infused and the time afterwards, tell us what that was like.
A feeling of very extreme fatigue. I was encouraged to get up and move around. I wasn't bedfast at all with this. In fact, I got up and got dressed every morning and just had access to my port so they could give me the drug. But I was able to get up and move around. I was not on a restricted diet. I could eat whatever I wanted. They did give me the pre-meds for this, solumedrol and Lasix. The solumedrol, if it's given too quickly, caused extreme tremors.
Mhm.
And it's like I had a vibrator stuck on the bottoms of my feet and I couldn't stop jiggling. And then they gave me Benadryl to kind of counteract all that. And it kind of made me snockered. And I was quite entertaining, I understand, after the Benadryl, because couldn't talk. I really had trouble with my speech. So, but the side effects, the two main side effects, extreme fatigue and the bone coldness, the internal coldness. No matter how many covers you put on, no matter how many sweaters you wear, you feel ice cold all the time. Those were the two main things. But miraculously, after the infusions were finished, after the 4 days, those symptoms all went away.
Mhm. So how do you feel today and how are
I
you
feel
doing?
wonderful. I feel really good. My hemoglobin's up to 9.1,
Mhm.
which is still low, but my body is accommodated for the lower hemoglobin status. So I'm able to carry out my normal activities of daily living. I can do whatever I want. I can eat whatever I want. I'm not restricted at all.
So tell us the message that you want readers of your story and those listening on your podcast. What's the message you want them to hear?
I want them to know that not everyone has the same side effects. Not everyone will undergo the same line of treatment, but these are definitely options that you might bring up with your physician. Don't be afraid to talk to your physician, do your research, but then also be aware that you can't always believe everything that you read online. So go to a reputable source like National Institute of Health, American Cancer Society, and they have access to all kinds of articles, research that you can use to help make a decision. Talk to your doctor. I've been lucky with Dr. DeMarla that I've been able to give him articles that I have found about the different types of therapy. And he says I keep him busy, keep him on his toes, keep him current on things. And it's really been a wonderful collaboration do you want to do this or would you be interested in this? Not you're going to do this or this is what I want to do. And it's been a blessing in disguise to do that. It's been a lot of fun. I don't mind going to the doctor at all now.
Now, when you underwent the ATGAM equine therapy and you had those side effects and you went through that experience, was that something that you had expected through your discussions and your research? Did anything catch you by surprise?
No, not really. Well, the tremors caught me some by surprise, but have restless leg syndrome anyway, and I take a drug called Mirapex.
Mhm.
I found that if I took that a couple of hours before the therapy started, it helped control the tremors. Also, discovered that if you take your time giving the solumedrol and the Benadryl, kind of space it out a little bit, the symptoms aren't as bad, which was a help because I was able to function.
We're talking to Deborah Smith. She's a nurse, and we're talking about her KevinMD article, Battling Aplastic Anemia, My Journey with ATGAM, which is antithymocyte globulin, equine therapy. Deborah, will end with some of your take-home messages that you'd like to leave with the KevinMD audience.
I've done a lot of work with residents and new nurses. Two things I'd like to share, would like them to share. They have superpowers, the power of observation and the power of listening. Go ahead and embrace the technology that's out there because that's going to help you. But your patient is your number one source. Listen to what they have to say. What might be subtle or inconsequential to the patient could make a big impact on their, as far as their treatment is concerned. Use your powers of observation. If you're going to be seeing that patient frequently, you're going to pick up on subtle changes in that patient's condition. They may not be aware of it, but you might be. And I was also tell the patients, okay, when you're first diagnosed with cancer or anemia or whatever, it's going to be a shock and it's going to be scary. Write down your questions before you go to the doctor the first time. Also, write your medical history down because you're going to be nervous, you're going to be scared, and you might forget something. If you have it written down, you can share that with your clinician, and they will be able to figure out what's going on and plan the best plan of care for you.
Deborah, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you so much.